This is the Critical Conversations podcast, a KPOV special project developed to feature unique perspectives and the courage it takes to go there, challenge mundane thought, and question the norm.
And we're in the studio today with Dr. Carol Petherbridge. And she's a local naturopath who's the founder of Freedom Regenerative Medicine here in Bend.
Yes, I am the founder of Freedom Regenerative Medicine. And the word regenerative medicine for me really relates to my philosophy as a naturopathic physician, which is that we work with the body to help it heal itself. And regeneration happens all the time within the body. There's also some branches of medicine that have taken regenerative medicine way out into the scientific and technical field that, could eventually be that we're regenerating organs or tissue or spines. So I'm not quite there yet. So my approach is applying therapies that use the body's own ability to heal itself. And I specifically focus with women's urinary and sexual wellness. That's my realm.
I think that's wonderful.
I do too. And so I just want a disclaimer that we are not doctors or KPOV is merely presenting this information. Okay. So, let's talk about some of the issues that women deal with. I know, and before we do, I think Carolyn and I were saying, how do we refer to this? I mean, do we call it urinate, pee-pee? What are we going to say?
What's the mature
What's
term?
the mature? We want to keep
that still
this.
brings a smile.
Exactly. VV, T, whatever.
We could also call it bladder leakage or leakage.
Ooh, okay.
But, I have to say, when I realized that we were going to have this topic today, these are all the questions that I know that we didn't talk about. We didn't talk about this in my family. And I know in my grandmother's time and before my grandmother, they didn't talk about this. And in fact, if women attempted to, they were often put into mental hospitals. Mm-hmm. So even though we kind of giggle over bladder leakage, mm-hmm. I'll remember that. It's still such an important topic.
You bring up a great point, Carolyn, which is this is an area that we're just beginning to open up the conversation about. And that really is my top priority, is to help women begin the conversation and to talk about these things that are embarrassing or uncomfortable, or maybe a woman doesn't know who to ask about these topics. So I'll give you a couple statistics just to give us a little ground here to work from. Excuse me. 30 to 40% of women have sexual dysfunction, especially lack of desire. I mean, that's a huge number. That can be women of all ages, all ranges there. And then looking at incontinence, there's statistics that say anywhere from 3 out of 4 women will experience incontinence at some point in their life. And there's also a lot of myths around this that, you've had a few children and now it's just part of aging, or, that's what happens as we get older. And I just want your listeners to know that incontinence is not a natural part of aging. It's a common part of aging. And there's a difference there.
Yeah, interesting, because I remember a group of friends went to a fair, and we were walking by it was a bunch of couples, and we were walking by the bathroom, and the man said, "There's not a bathroom my wife can pass." We all went into the bathroom. It seemed like we just went from bathroom to bathroom, and we didn't even think about it. It's like, well, that's just kind of normal for us. We better go before we go. So.
That's another great point, Jackie. Besides leakage, there's also frequency and urge, which all of these things, both urinary and sexual issues, really impact the quality of a woman's life. So, for example, you want to go grocery shopping, or you just want to, pick up your grandkids or play with them, or heaven forbid, jump on a trampoline.
No, I can't even imagine right now.
I know, we got you on that one, didn't we, Carolyn? Yeah. I saw your face. That shows you just the need for repairing and regenerating those structures and those tissues around the urethra and the bladder and the vulva tissue. So that's the approach that I take. And because of that, I help women regain their freedom. My tagline is to, helping women laugh, dance, and love freely again. That's my passion, is to help women get back to that active, joyful life, being able to go cross-country skiing or
jump on a trampoline,
go hiking, biking, pickleball. You wouldn't believe how many patients that I see that play pickleball, but they have to wear a pad during that process. And, so really I am about helping women understand the array of options. So we can do nothing all the way to we could have a surgery that addresses bladder placement. And there's a lot of options in between. And that's the range that I'm in. I have therapies that can help improve the function and the actual tissue integrity so women can enjoy life again.
Right. So, just for people who are listening, I know as we get closer to home, I don't know if any other women feel this way, as you start driving into your garage, and I'm going to be real candid that I had this issue that I dealt with. And it was the same kind of sense of urgency. I pull into the garage and I have to sit in the car, and I learned to sit in the car and wait till the moment passed and then go into the house, because if I didn't, I would have an accident, and it was humiliating. And I've had accidents at supermarkets, and I never knew that there was anything. I just never knew to even question it. So I'm so happy that you're here. Tell us a little bit about some of the things that can be done.
That's a great question. So when I look at when a woman comes to consult with me, we, of course, look at her age and her history. How many children has she, any childbirth, and were there complications or scar tissue, or is there pain or discomfort in the pelvic organs? And, what has she tried so far? Often women have tried maybe pelvic therapy, or they've tried to do Kegels, or they've tried medications and they're not seeing much result. And there's a big gap from that all the way to surgery. So regenerative therapies, which is I call the FemShot, which uses PRP, platelet-rich plasma, which is a patient's own blood, and we concentrate these amazing, powerful regenerative messages from the platelets to signal the tissue to repair itself. So that tissue around the urethra, we call a sphincter, which helps close off and shuts the flow down and keeps the urine where we want it, that can be, begin to lose its tone and function. So we can put that PRP message right in that area to start that regenerative signal and help women regain good function of those tissues.
Right. I know there's also PT, physical therapy that was really surprising to me.
There's a great array of pelvic therapists here in Bend. We have so many great resources in that area too.
And using the method that you mentioned, how is that applied?
Well, I'd rather not take our time to go into all the technical aspects. My website covers that beautifully.
Great.
But those are important questions. I mean, I could go on for hours about that.
And so we're going to ask you now, but we hopefully will ask you again at the end, your website for people who are going, okay, I want to check this out right now.
All right. So go to your browser and put in www.freedomregen, med.com. freedomregenmed.com. The other technology I use, which is just really exciting to me, is something called Vivive. And this is using a radio frequency or a warming to the tissues to rebuild collagen. I kind of jokingly call it the facelift for your vagina. And radio frequency, what this particular device first uses a cold pulse or a cryo pulse to preserve the layer of tissue on the outside so we can get this nice regenerative message that is allowed to penetrate deeper into the tissues, and then a cold pulse at the end, and then multiple pulses are applied in the vaginal area. And this is the only one-time treatment that is in the process of being approved by the FDA specifically for urinary incontinence. And they're almost complete with their study. And most procedures require 2, 3, or multiple sessions in order to get a good result. So we're on the cutting edge here in Bend.
This could be a whole new chapter of the vagina monologue.
Totally could.
Yeah, and it's just an update, and the ability to know that the restrictions that aging often places on us can be avoided. And you had mentioned earlier that so often women wait too long.
That's a great point. So I see, here's an interesting statistic. On average, women wait 6.5 years from the first time that they have symptoms until they actually get a diagnosis from for their bladder problems. And this is a statistic from the National Continence Association. Really, honestly, Carolyn, I see women who, in fact, last week I saw someone whose last child was in their 30s. So she had been suffering with incontinence for almost 30 years of some level. And of course, it gets gradually worse as time progresses. So for younger women, I really like to plant that seed that, please, if you're starting to have symptoms, laxity or incontinence or even issues with sexual function, address them sooner than later. It doesn't generally get better with time. It usually goes the other direction.
We spend all this money on facials to get our face to be soft and smooth. So what do you say to that?
That's a great question, Jackie. And during the break, we were joking. I'll share my joke that I have quarterly events called the Women's Intimate Support Circle, and it's where we come together in an environment where we can bring our questions and really start the conversation. And during our last event in September, I was sharing with the women that we pay so much attention to our face and our skin and all of these aesthetic aspects of our appearance, but I'm in my early 60s. I'm starting to get some wrinkles, but you should see my vagina. She looks great. And everyone laughs, and that tells me that you get the joke. You immediately get that understanding of we pay all this attention to, the outer aspect, but we really need to also address the internal environment of the vulva, and it's really important.
Yeah, absolutely.
I laugh because I think of the inner beauty and the outer beauty, and okay. I think I need to do some attention to both the upper and the lower, the inner and the outer.
So I wanted to ask you, what population do you serve? Do you serve the trans population?
I would love to serve the trans population. I have not had an experience yet where they have come to seek my services, but I want them to know my door is completely open. And I use the word women's healthcare just to identify really the structure or the anatomy that I work with. I work with vaginas and clitorises, so that however somebody identifies, that's fully supported.
Oh, perfect.
So when people say to you, and so what do you do, Dr. Carol? What do you say?
I say that I'm a regenerative medicine practitioner working to help women stop peeing in their pants and to have better orgasms.
Well, let's talk about the big O. A couple of weeks ago, we had Dr. Jane Gwynn on, and it was a wonderful conversation. And we talked about the fact that women feel pain, and so they stop having sex, or maybe they're, feeling uncomfortable, or they're self-conscious about, their vagina after they have children. What is there available for them? Is it the same procedure?
Yes, it is. And I love Dr. Jane. In fact, she was one of the panelists at my event in September, and she just brings so much information to that realm. Really, so let's look at sexual intimacy, and I think one important thing we can all relate to is that produces oxytocin, which is a hormone that initially helps a woman feel bonded to her baby. Mm-hmm. And during sex and intimacy, we have higher levels of oxytocin. Mm-hmm. And they've actually done studies that show that this makes our brain work better, mm-hmm. that we're more focused and cognitively improved. So sexuality is really one of those, if you don't use it, you lose it type of thing. So the therapies that I address or that I offer help address women being able to have more sensitivity, more arousal, better orgasms, better sensation, because we're supporting all of those tissues involved with those processes.
Do you recommend any hormones? I mean, is hormones part of your therapy?
General hormone therapy is not part of my therapy. I'm not doing primary care. I'm really focused on the incontinence and sexual function. So I do refer my patients to the other wonderful practitioners in town. I do have, in fact, I'm working with a company right now to produce a topical cream to really help repair, moisturize, regenerate tissue to keep it soft and supple and functioning and feeling comfortable.
Should women use creams that are like they do on their face? I mean, I put a night cream on. Should I be putting a night cream?
Yes, I would say yes. In fact, that's one of the things that I am cultivating and working with my patients and recommending. Of course, I recommend natural, organic, topical things because it's going into tissue that's going to absorb really quickly. So I think, first of all, it's really important to find something specifically for that tissue, not just don't put your face cream on there. The inner tissues are very different than the outer tissues on our face. So, I have lots of resources for that for women that are wanting to know, well, what should I put on my vulva?
Yeah. Well, we just have like a few minutes left, but I wanted to mention that your office is a very safe space. That you've created that, so there's a lot of confidentiality. And how did you set up your office? It's a very welcoming place. I went to visit it before our interview.
Thank you, Jackie, for that reminder. Yes, we're addressing very private, intimate concerns. So I schedule my patients so that when you come in to see me, you're the only patient I'm seeing. In fact, I have these beautiful chairs in the waiting room, and they're going to be there forever because no one ever sits on them. I don't have patients waiting. I'm ready for you as soon as you walk in the door. We spend all the time together. I'm always 100% focused on the person in front of me, and I'm there to create a safe enough environment to start these delicate conversations that feel safe and open.
Terrific. Well, we could talk about this again for another hour, but in the next minute, can you tell us how people can reach you?
Yes.
And what you got going on?
My website is the easiest place to reach me, freedomregenmed.com. And I have an event coming up at Open Space, January 24th. It's a free event to the public, and we call it the Women's Intimate Health Support Circle. And I bring a panelist of local women-focused experts to chat and have these conversations. We've had other events where we've talked about lube and orgasm and sphincters and all of these, very important topics in an environment where you realize you're not the only one who has these questions or these issues. So you can find the link on my website for that event. And I have a list of all my past panelists and past events on there too. And I'm on Greenwood Avenue, right here in town. You can find me on the internet, and if you call our phone number, and you can ask to have a phone call and find out more about what we do.
And I do want to say that if you're driving and you don't have something to write with, just checking out regenerative
Freedom Regenerative Medicine.
Right. You will get to the office of Dr. Carroll.
Yeah. And I go by Dr. Carroll because Petherbridge is a mouthful. So even Dr. Carroll, Regen Med, you'll find me.
Great.
Well, thank you so much. That we really appreciate you being opening up this conversation.
You've been listening to a KPOV Critical Conversation. To hear more engaging interviews on important topics, please visit kpov.org/criticalconversations.